Measles is a highly contagious viral infection caused by the rubeola virus. It primarily affects children but can occur at any age. Before the introduction of the measles vaccine, it was a common childhood disease, but vaccination has greatly reduced its prevalence in many parts of the world. However, outbreaks still occur, particularly in areas with low vaccination rates. Symptoms of measles. Measles symptoms usually appear 10 to 14 days after exposure to the virus. Early symptoms include fever, often high, starting around 38 degrees C to 40 degrees C, 100.4 degrees F to 104 degrees F. Cough, a dry, persistent cough. Runny nose. Conjunctivitis, red, watery eyes. Cutlick spots, small white spots that may appear inside the mouth 2 or 3 days after symptoms begin. They are a key diagnostic feature. Rash appears 3 to 5 days after initial symptoms, starting as flat red spots on the face and spreading downwards to the trunk and limbs. The rash can coalesce into large blotches and last for about a week before fading. Complications. While measles is generally a self-limiting illness, it can lead to serious complications, especially in young children and those with weakened immune systems. Common complications include ear infections, pneumonia, diarrhea, encephalitis, swelling of the brain which can be life-threatening or cause permanent brain damage, blindness, rare but possible, especially in vitamin D deficient individuals. Transmission. Measles spreads easily through respiratory droplets when an infected person coughs or sneezes. The virus can remain contagious on surfaces and in the air for up to 2 hours after an infected person leaves an area. The person with measles is contagious from about 4 days before to 4 days after the rash appears. Diagnosis. Diagnosis of measles is typically based on the characteristic symptoms, especially the presence of cutlick spots and the typical rash. Blood tests or throat swabs may be used to confirm the diagnosis, particularly in outbreak settings or where vaccination records are unclear. Treatment. There is no specific antiviral treatment for measles. Management focuses on relieving symptoms and preventing complications. Rest and hydration. Plenty of fluids and bed rest are essential. Fever reducers. Paracetamol, acetaminophen or ibuprofen can help lower fever and relieve discomfort. Vitamin D supplementation. This can reduce the severity of the disease, especially in malnourished children or those with vitamin D deficiency. Treatment of complications. Antibiotics may be needed for secondary bacterial infections like pneumonia or ear infections. Prevention. Vaccination. The most effective way to prevent measles is through vaccination. The measles vaccine is typically given as part of the MMR measles, mumps, and rubella vaccine, usually administered in 2 doses. The first dose is given at 12 to 15 months of age. The second dose is given at 4 to 6 years of age. Vaccination is highly effective, with 2 doses providing around 97% protection. Isolation. In the case of an outbreak or if someone is infected, isolation is crucial to prevent spreading the virus to others. Infected individuals should avoid contact with others, particularly those who are unvaccinated or have weakened immune systems. Post-exposure prophylaxis. If someone has been exposed to measles, receiving the measles vaccine within 72 hours or immune globulin for those who cannot receive the vaccine within 6 days of exposure can help prevent the disease or lessen its severity. Went to seek medical help. High fever that persists or worsens. Difficulty breathing or persistent cough. Signs of complications, such as ear pain or confusion. If you suspect that you or your child has been exposed to measles, particularly in areas with recent outbreaks or in individuals who are unvaccinated. Conclusion. Measles is a serious illness that can lead to complications, especially in vulnerable populations. Vaccination is key to preventing the disease, and early recognition of symptoms can help manage the illness effectively and prevent further spread. You said. Meningitis. Chabot said. Chabbed meningitis is an inflammation of the protective membranes meninges surrounding the brain and spinal cord. It can be caused by infections, viral, bacterial, or fungal injuries, cancers, or certain medications. Meningitis can progress rapidly and can be life-threatening, particularly bacterial meningitis, so prompt diagnosis and treatment are essential. Types of meningitis: viral meningitis, the most common and generally less severe form, often resolving without specific treatment. Enteroviruses, herpes simplex virus, and mumps are common causes. Bacterial meningitis, the medical emergency that requires immediate treatment. Common bacteria include Neisseria meningitidis, meningococcal, Streptococcus pneumoniae, pneumococcal, and Haemophilus influenza type B. Fungal meningitis, less common and occurs primarily in people with weakened immune systems, such as those with HIV/AIDS. Cryptococcus is a common cause. Parasitic and non-infectious meningitis, rare, caused by parasites or inflammatory conditions like autoimmune diseases or cancer. Symptoms of meningitis: symptoms can develop over several hours or days and may vary depending on the type and age of the patient. Classic symptoms include high fever, severe headache, stiff neck, nausea and vomiting, sensitivity to light, photophobia, confusion or altered mental status, seizures, sleepiness or difficulty waking, rash, the purplish or red rash that doesn't fade when pressed, a sign of meningococcal meningitis. In infants, symptoms may also include poor feeding or difficulty waking, constant crying or irritability, a bulging soft spot on the head, fontanelle, seizures or body stiffness. Complications without timely treatment: meningitis can cause severe complications, especially bacterial meningitis. Hearing loss, seizures, brain damage, learning disabilities, amputation due to severe infection, death. Bacterial meningitis has a high mortality rate if untreated. Transmission: bacterial meningitis, spread through respiratory droplets or close contact, e.g., coughing, sneezing, or kissing. People can carry the bacteria in their nose or throat without being ill. Asymptomatic carriers. Viral meningitis, typically spread through contact with infected stool, respiratory secretions, or surfaces contaminated by the virus. Fungal meningitis, not contagious and is contracted by inhaling fungal spores, usually from the environment. Diagnosis: diagnosing meningitis typically involves physical examination, checking for signs like neck stiffness and sensitivity to light. Lumbar puncture: spinal tap. A sample of cerebrospinal fluid (CSF) is taken from the spine to test for infection, looking for the presence of bacteria, viruses, or fungi. Blood tests, to check for infections or inflammation markers. Imaging: CT or MRI scans may be done to rule out other causes of symptoms, such as brain abscesses. Treatment depends on the type of meningitis. Bacterial meningitis, immediate treatment with intravenous IV antibiotics and sometimes corticosteroids to reduce inflammation. Hospitalization is often required. Viral meningitis, usually self-limiting, so treatment focuses on symptom relief with rest, fluids, and over-the-counter pain relievers. Antiviral drugs may be used for herpes-related viral meningitis. Fungal meningitis, treated with antifungal medications, often administered over a long period. Other treatments, addressing the underlying cause in cases of non-infectious meningitis, such as reducing inflammation or treating cancer. Prevention: vaccination. Vaccines are the most effective way to prevent bacterial meningitis. Key vaccines include meningococcal vaccine, protects against Neisseria meningitidis. Pneumococcal vaccine protects against Streptococcus pneumoniae. HIV vaccine protects against Haemophilus influenza type B. MMR vaccine, measles, mumps, and rubella vaccine, helps prevent viral causes. Good hygiene practices. Wash hands regularly, avoid sharing drinks or utensils, and cover your mouth when sneezing or coughing to prevent the spread of infections. Prophylactic antibiotics. Close contacts of someone with bacterial meningitis may be given antibiotics to prevent infection. When to seek medical help. Seek immediate medical attention if you're someone you know developed symptoms of meningitis, especially fever, stiff neck, and a severe headache. Delaying treatment can lead to severe, life-threatening complications. Conclusion: meningitis is a serious illness, especially bacterial meningitis, which requires urgent treatment. Vaccination, good hygiene practices, and quick recognition of symptoms are crucial to preventing and managing meningitis effectively.